employees. And I would ask that in light of everything else that's going on, that the importance of flu shots this time of year can't be overemphasized. So please make that happen. Second thing, masks are going to continue to be a huge part of this control. It's expected today that the governor will continue the mask mandate. I think at 2:30 is his press conference, so that's certainly expected given the current situation in the state. As far as masks are concerned, I want to just update you all on Ann Sweet and her group to date have delivered 11,500 masks. They've sent 900 to Wawasee schools, about 300 to fellowship missions, 50 to home care and hospice, and 250 to the fire stations for the public to pick up. They're working on child's masks for the Department of Child Services and Beeman Home, as well as at the fire station. So they are working hard. It's important that we continue to use masks. Is probably the thing that each and every one of us can do to protect not only ourselves but those around us. So I did want to mention that it's we certainly don't want to go backwards, and this is the one thing we can all do. So I also want to emphasize that right now CARES Act testing is continuing at MedStat and Parkview for those without insurance. So there's been some calls to our office and that has been discontinued. That is not the case at the current time. MedStat and Parkview are continued CARES Act testing sites for those without insurance. So we also had some calls about the drive-through testing down at Central Park, and that has been gone for several weeks, and we don't expect that to be back. That gap is going to be filled with the State Department of Health testing site that the Bowen Center and Kurt are working feverishly to get started. So with that, let's invite Kurt to talk about the ramp up of getting that site started. And what you got, Kurt?
Okay, well, yesterday the mayor got a call from the health department talking about the number of cases and the need for more testing. So we called the governor's office. They got a hold of Dr. Box. Dr. Box got a hold of Bob Weaver of the health department and said, today, Wednesday, we'll be getting the pallets of the material. A little while ago, I got a call from the driver. He said he's got 2 pallets on the way and they'll be here by 11:30. Then we'll unbox, get all the equipment out. We also, they're sending a trainer from South Bend, Region 2, to train on the computer system that they're providing us and the Zotec software that they're providing. And they've had a little bit of trouble, but they seem to think that they have that straightened out. So I have my IT team will be trained on that, and so they can do any troubleshooting. And then we needed training of the staff to actually administer the procedures. And I'm so pleased and thankful to Ivy Tech. Alan Decker connected us to one of their nurse trainers. And she had, even though they're in the middle of academic testing right now of the students, she had a window of time today between 11 and 12:30, and we will get staff trained in the actual procedure. Also thankful to MedPark and Jay Dale, the CEO, Kim Finch, the number 2 person, and Dr. Remington for allowing our staff to make arrangements for our staff to actually watch the med staff testing site work. You know, how it flows, how they actually administer the tests, things like that. And so I've got people hired who are giving their notice to their current employers, but in the meantime, they're getting trained today. And in the meantime, I've got a number of Bowen Center staff who, fortunately, I'm so pleased stepped forward to volunteer to man the clinic for the next 2 weeks until those full-time employees come on to work in the test site. And so they will receive that training, and they're all over at MedStat right now as I'm speaking, observing their clinic. And their nurses over there have been very kind to give a lot of explanation of how they do it. It's a different test than what we'll do because they do the interpretation in-house. They have machines for that. In our case, we will package them up, and then a courier picks up every evening, or at least that's what I've been told. And then they take the samples and get them interpreted, and then they follow up with anybody who's positive and those who aren't. Dr. Box says that there's a new step in the process, which she believes is very reliable. It's a saliva test, and it's read right on site. And if it's tested positive, there's a high probability that it actually is positive. And so then we send the person home to quarantine and get that information to the state. If it tests negative, that test, the saliva test, is not reliable if it's negative. There's false negatives. And so that's when we would do the nasal pharyngeal, where you take the swab and put it into the nasal cavity and into the sinuses. We're hoping to be up and running tomorrow already, depending on the training today. The signage has been ordered. It's been designed and ordered, but it's not delivered yet, so there'll be a little delay on the signage. And like I say, my full-time staff who are bilingual, bicultural, and I just met them over at the MedStat clinic this morning, look highly motivated, very interested in working for Bowen Center and serving the Latinx community as well as the whole community. But like I say, they're bilingual, bicultural, and we'll be adding some more staff. But those are two that we've recruited already. Gamal Hernandez will be overseeing the clinic. So that's the progress report. I don't know, did I miss anything?
No, that's great, and I'm sure we'll take some questions. And I want to certainly thank County Department of Health, Bob Weaver in particular, for getting this thing rolling when he was contacted by the state. We've all worked together, these two to either side of me, Dr. Remington and Teresa, have done a marvelous job working through this. Kurt, you at Bowen Center getting this thing rolling. I think giving the governor's office a call yesterday, we kind of wanted them to know how critical this was, that we get moving, and they responded well. So kudos to the State Department of Health. But I also want to thank MedStat, as you mentioned, for allowing training to go on. Ivy Tech, quality of their students. Their students are going to come out and teach these individuals how to do this testing. And Kurt, thank you for reaching out to them. I also want to thank Liliana Quintera at the Northern Indiana Hispanic Health Coalition. She's providing some staff. Again, as Kurt all of a sudden got the call that we will start Thursday, the staffing was an issue, and Liliana has provided some staff in the interim as well. We use some CARES Act funding to help with that. So it's truly a community effort to get this clinic established. And again, there was a catalyst yesterday from the governor's office that got this thing rolling. And a big thank you to Andrew Forster at the governor's office for taking this project on. And by the time I got off the phone, I think he'd already been on the phone with Dr. Weaver and Dr. Box. So all good stuff. You are planning on getting started tomorrow.
That's the intent. Again, it'll depend on the training today, but that's the intent.
So I want to reiterate that MedStat and Parkview testing will continue as this clinic gets up and running. Once we get this clinic established, we'll take next steps. But for right now, we will have, as of tomorrow, we'll have 3 testing sites. We'll have the Bowen Center site on DuBois. We will have the MedStat site, who's done a great job for us from day one, and the Parkview site that we've added a month or 2 ago. We will have 3 sites tomorrow. So, but remember, MedStat and Parkview.
And physicians' immediate care.
And physicians, yes. But the CARES Act testing is provided at MedStat. Those without insurance is provided at MedStat and Parkview, and will be provided at Bowen Center tomorrow. So those are the, I hate to use the word free sites. If you have an insurance card, please bring the insurance card, but if you don't, you will not be turned away at any of those sites. And then there are private sites that are providing care, I assume with insurance cards as well. So, Kurt, anything else you want to add about any logistics of getting started? Do individuals need to call in? Can they just drive through? How will that process work?
Yes, at this point, we're not requiring people make appointments. At MedStat, again, there's a process where they collect the information up front, schedule an appointment, drive up, and then they come out and do the testing. We will collect all that data at the site. At least that's the plan at this point. All this is subject to change as we see how the clinic actually works. But we'll collect the data on site, and no appointment needed, just drive up. Then we do the testing, and then if they tested positive, we send them home. I reached out to Sheriff Kyle Dukes, and I just said, you know, if on a late afternoon or on Saturday, if a lot of people show up for the testing and we end up with a long line down Du Bois, he's aware. They'll be paying attention to that. And again, they'll do what they need to do to mitigate any traffic problems. So again, the sheriff is another one, and Scott Whitaker, the police chief, are wonderful to work with, and I appreciate their support too.
So the model is
logistics. Yeah.
The model is very similar to the drive-through down there. You just show up and get tested.
Yes.
All right. All right. Are there any immediate questions for Kurt regarding the testing site?
What are the
Could you guys speak into the microphone, because I know a lot of folks are going to want to hear this. Make sure that's on. I probably didn't. Let's do that. I'm sorry. Okay, kind of just push it and hold it. Okay, you're on.
Okay. What are the hours expected? I know there's Tuesday through Saturday or something like that.
So Sunday and Monday, we will not be doing testing. And then we'll be testing over 40 hours in the week. So every Saturday from 9 a.m. to 3 p.m., every Saturday of the month. And during the week, Tuesday through Friday, we start either at 10 or 11 o'clock, and then on the days, and then go on until either 6 or 7. And I don't know, I don't have in front of me which days those are. But it'll be one day open till 7, next day till 6, 7, 6, like that. So that people who are working during the day can access then and on the weekends, as well as then during the day. And we'll be doing this through June of 2021.
Mr. Spaulding.
Also, what are the age parameters?
We're taking age 2 on up. So children, teenagers, adults, and seniors.
Again, this is a program that the Indiana State Department of Health has offered to, I believe, all 92 counties. I don't know how many have taken advantage of it, but the idea here is that it's difficult for them to keep mobilizing their drive-through testing, so they are providing equipment, training, the software, the communications, the reporting, all that. They're providing every bit of it, and then money for staff. But we need someone to organize it. And again, through the Department of Health, Bob Weaver and this whole group here, their discussions with Bowen Center, that's how this clinic got established as a State Department of Health clinic. So this is, again, a state initiative that we've taken advantage of, and I think once we get up and running, it's going to be a very, very good thing. Dr. Remington, you want to jump in on the clinic and anything else you want to talk about today here, please?
Thanks, Mayor. Thanks, Kurt, for coming along very strongly with our need for additional testing. And you have been amazing in getting out there and shaking the bush to get this done. It's taken a little shaking of the bush, and you've done very well. Thank you. All this is very timely. Regionally, we are seeing the heaviest presence of COVID yet, which is very disappointing. St. Joe County, Elkhart County, Kosciuszko County, I understand the Muncie region and Evansville region. Particularly, they are heavy right now. And it's filling up healthcare settings again. So we need the community's help. We need people to wear a mask when indoors. We need people to rethink congregated indoor gatherings. We need people to socially distance when they can. Be careful with great family events, weddings, funerals, parties. These are spreading events for us. We don't have a vaccine yet, as you know. Hopefully that'll come before too long. But at least we can do these things. And those are voluntary. We need good neighbors in Kosciuszko County willing to do this. To trample on your own personal space enough to do these things. Please. We really need you. If you take a step back from our region, the state is showing a bump up, but it's not disastrous. It's nowhere what it was in April. Nationwide, same thing. If you go to COVID view of the CDC, you'll see a little bump up for the aggregate data for our country. It's not the order of April, and those are good things. But regionally, this county is seeing just inordinate pressure from this virus now, which is a disappointment. So we just need to hang in there. This will ebb and flow, I think, for a while, and we are certainly in a heavy presence now. But it will eventually settle down again. The good news is, thanks to a lot of work with our schools, Teresa, and she'll have her report here in just a minute, thus far, our honest opinion is that schools are not the incubator they were contemplated maybe to be. Influenza in schools, you do think of the incubation of the schools, and when influenza gets really bad, you close schools for a period of time to just disrupt the spread. COVID, it really hasn't seemed to really come out strongly, at least yet. Now again, stay tuned. So I don't think we need to close schools unless there's an administrative burden such that for whatever reason that school just simply has to close. As a health officer, I do not see the need in what I read and what I watch in our metrics to suggest I must order schools to close and to go to virtual online instruction only. That may be their prerogative, certainly, to do that, if administratively they feel, because of the burden of isolation or quarantine impacting their constituency, they have no other choice. So the schools reflect community spread. The community is not reflecting a school incubator, and I must stress that point. So in the schools, they are dealing with families, kids, students, faculty, staff that are taken out by a quarantine directive. Not ill, but they were a close contact. 14 days, that's a long time. If they're ill or a positive test and they're isolated, 10 days, that's plenty long. I mean, that's long enough. Someday we will maybe have different directive regarding the the length of particularly the quarantine directive. I think discussion, as I've mentioned a couple weeks ago, is brewing. We in this county, under my directive, are following the latest guidance from the State Department of Health, which largely is reflecting the best thinking from the CDC applied to the state of Indiana. I trust they have a think tank there that is better than my think tank, and I'm leaning to their guidance. And so we are sticking with, usually, that 14-day quarantine and 10 days of isolation, modifying it occasionally for certain scenarios. So we need your help, Kosciuszko County. Need you to be good citizens, good neighbors. Thank you for all the community partners, by the way. Kurt, again, just a sterling example, and the mayor, and shaking the tree as you have for all the ancillary services that are swimming around this. It's really taking a strong community to get through this. I want to emphasize the role of flu shots. They don't prevent COVID, but they can mitigate the presence of a famous seasonal virus that will come our way in a few weeks and months, seasonal influenza. The vaccine's not perfectly effective, but it dampens it, which is good. We don't need more people with fever, cough, and achiness than we already have in the months ahead. So flu shots will help us. Please get one. If never before you've had one, this is the year to get one. They're very safe. They do not carry the virus in them unless you get a nasal vaccine, and that's offered to younger people. All the others have no live virus in them. Very safe. So thank you.
All right, thanks, Dr. Remington. Teresa, you're up with your school report, and you're right on the front lines here locally, so certainly appreciate your thoughts.
Good morning. We updated the school report. It's a little less information than some of the other times, and that just came down to we were too busy to pull the other numbers. So, but this is the meat and potatoes of the report because that's what we want to share. As is talking about schools, I think are doing relatively well. That doesn't mean they always feel like it, and we thank them because this is very difficult. And thanks to all the families that willingly and unwillingly are affected by the quarantines in particular. Right now, as of yesterday when I wrote this, there were 499 individuals that were quarantined through the health department for schools. That means that we help participate in that. Early on, we weren't tracking all of the individuals involved with the schools, but we added, so we're helping the schools monitor that. There were 16 more cases, so we think that's kind of still at a reasonable rate in the schools. We're not having super spreader events in the schools. We've had large quarantine events in the schools where one person that had a lot of contact with a lot of individuals takes out a big pool of people now at risk of developing COVID. So hopefully we can keep getting better, and sometimes we're able to see where the measures in place to limit transmission are working and we're not having a lot of close contacts, and sometimes it doesn't work quite that well. We did remove the college students from this report, and it's difficult to get all the information on some of the college students and to qualify it, so we wanted to make this a more pure report that really addresses our K through 12. With the college students, they can have been infected at home, they get sent home. It's just a very difficult number to track. I do request, most of our cases involving schools right now are things happening outside of schools. Again, socially, weddings, parties, social events. Right now, it is a time where, I would ask people to look at a situation and make a choice. you know, if you get COVID, you may not be seriously ill, but the numbers in our community need for people to take precautions that maybe take more precautions than what they may need personally to help dampen this in our community right now. So when we look at the severity of the cases involved with schools, we're very lucky. 16 so far have been asymptomatic. 36 are very mild, with that being less than 4 days of illness where they recover on their own. 5 mild, 2 moderate, that means it was a week and may have needed antibiotics or something else. And 4 were too early to have the data on that yet. So we still have the calendar there so we can see on October 12th, we had the most cases that we had. Only by 1, because back at August 17th, we had 5 cases, and on Monday, we had 6 cases. That did include over the weekend. Then the severity, most of the kids, the most common symptom that we're seeing in the school-related cases is fever. 19 of those cases had fever, 18 headache, cough, and goes down from there. So often, it's not that people are severely ill in this category either. That's been quite the relief that we're not fighting quite so difficult in this environment. Once again, just very thankful. Please remember, if your child engages in a social event and turns out they had COVID and maybe they get symptoms the next day, you can take out quite a swath of other students. Please consider this and try not to make it so you cost people more of their time. Although the quarantine is 14 days in school situations, there's another caveat to that number. That's 14 days from the last exposure to an active case that is contagious. So that 14 days is sometimes functionally 24 days. We will work with people and we'll look at that. If you can separate, we can respect that on a local basis. Sometimes that's not possible for small children, and that takes them out of school for a long time. So once again, reiterating the same thing everyone else has asked, please take precautions right now to protect yourself so you're not part of the transmission chain that's affecting our county.
All right, thank you. All right, questions? Mr. Spalding, you got a microphone there.
Dr. Remington, I'm curious, what's your impressions on why we're seeing this spike? Is it fatigue?
I really don't know. I would say that's top of the list of likelihood issues. People, you know, having weddings again and gatherings. They had hunkered down in the spring and early summer, but they're tired of the whole thing and need to get together. And I think that is a big piece. The demographic shift in the population who seems to be having a lot of the cases is interesting over the last several months. It's now that 19 to 29-year-old age group is really dominant. These are very socially active people, usually pretty healthy, mobile, doing stuff, wanting to get together. So I do think that's very likely. So I don't know that there's any one thing, though. There's not like a single setting. It's not a meat packing plant or a poultry processing plant. It's not agribusiness. It's not a healthcare setting where it's pouring out of. It's not the schools where it's pouring out of. It's broad community spread. And a very efficiently contagious respiratory virus. I mean, that's very, very clear in the midst of all this. And even though there's some debate in certain corners with the mask thing, I've heard those discussions, it just has to make some difference, especially if there's this growing notion of aerosol spread being a part of this. I don't know how else you contain it other than separating, avoiding congregating, better airflow in buildings, if you must be indoors, and wearing masks. Wearing masks has to make a difference to some degree. It's not perfect. So it's really quite the pandemic. It really is. You know that pandemic a century ago went on 2 years, maybe into a third year. Yeah. 1918, 1919, a little bit into 1920. These have these pandemics, influenza-like pandemics, really have legs to them. And this one's just a very contagious virus. I've heard those discussions just recently. More contagious, they think, than influenza, not as contagious as the very contagious examples of measles or chickenpox, which are true aerosol-borne viral respiratory pathogens. But COVID is very efficient. Yeah. Great question.
So if I may, given the fatigue and the numbers you're seeing, are we moving toward the point where we're going to have to take more restrictions?
Yeah, I just don't think society is going to go there easily. Certain jurisdictions politically feel more umph to be able to do that. But there is tremendous debate. Even the World Health Organization, which is, I think, fairly liberally minded, has really come out and say from a risk versus benefit ratio, that whole clamping down thing has its place, but not of great durability. And that's right out of the standard public health textbook. When we started this whole thing, you can only do that massive clamping down thing for so long, the fatigue issue, if nothing else. Yes?
Also, are you of the mind that if we had some intense mask wearing in the community that we could actually just slow it down significantly?
I've heard those discussions. I'm not the ultimate scientist to give you my take on the science in that regard, but I tend to agree with those thinkers who've expressed that.
Can I?
Yeah, go ahead.
This is fairly anecdotal, but we take a lot of calls in our office. Many of the cases now are not, they have no idea where they got it. They know they went to a party where other people were shortly thereafter found positive. We're hearing all kinds of events where people are going out even though they know they're COVID positive. This is problematic. And so, I do want to encourage people to use their masks now, but the social events are seriously driving what we're seeing right now. The more interpersonal events, the things where none of us really want to wear a mask at all.
Also, are you still able to do effective contact tracing, or is it just too broad at this point?
Well, remember, the state does the contact tracing through their call center since May 18th. So like our office is mostly designated for the school issues on that contact tracing. We help the schools do their contact tracing. We help any local entity or business that calls in and says, we had an employee. The call center does refer people back to us for that contact tracing too, where a business owner may call and say, I have this many employees, I tested positive, what do I do? And then we can help walk through those risk factors and help decide who needs to be out of work, who which precautions need to be followed, what they need to do. So I assume the contact tracing is going on, but that is happening through the call center. We don't have direct control over that. And one other thing with the numbers, I think the numbers are going to be shaky in the next few days because there has been a lot of time where the state website that first tracks those testing numbers is down. And so I have some idea what's going on because we can talk to the providers and things, but I think those numbers, I think yesterday's numbers were suppressed significantly because there's a lot of missing information. I assume today's numbers are going to be even more suppressed, and then we'll see a rebound from that at the end of the week. So, and the positivities aren't right. There's not enough tests in the positivity rates, as we've discussed for months.
Yeah, for those watching the COVID dashboard from the state, our positivity rate is extraordinarily high. And we, again, have a positive bias on that statistic. We just are having a hard time getting the negatives to be publicly reported. So that positivity rate is extremely high, but there's a statistical aberration in that. But we're feeling real pressure from lots of cases, let me just tell you.
We are, yeah. we still know what's happening because of the positive case rounds, even though we don't have that positivity rate, because we can still go, okay, what's happening in our community? So we know where the case counts are and who's busy and who's, well, everybody's busy.
Yeah.
Kind of a hypothetical. Yesterday, I think it was, Chicago announced that it was, if you came from Indiana to Chicago, you'd have to quarantine for 14 days. If the reverse was true, if people coming from Chicago had to Indiana or this county had to quarantine for 14 days, how would you put that in place? How would you, make sure that happened?
Right, and enforcement is difficult. I have a daughter-in-law who's a Canadian, and they can't go back to see her parents right now. They could, but because of their quarantine, I'll just tell you how the Canadians do the quarantine. They're on it. They staff it. You have to staff it. You got to be on the phone, maybe make occasional calls to the home, see if they're there. It takes that. We couldn't pull that off with the resources we have. It would take robust banks of people on phones to track that. And it has to take a willingness at a port of entry to whatever your geographic area is that you're wanting to kind of cordon off. You have to have a portal of entry that you can control and get names, right? Yeah. Names and places and contact information. And I don't know if we want to set up a booth on Route 30 or the Turnpike or Route 15, but I doubt that'll happen.
Okay. And you mentioned the regionally it's kind of, I don't know, hot everywhere.
Mm-hmm.
Is there in this county specific hot spots like North Webster, Silver Lake, or?
I have personally not looked at that geographically. I've not heard that come up in the discussion with Teresa in the last 2 weeks.
Not in particular.
Yeah, I don't.
No,
I just think it's a broad regional issue.
Okay. And then I was reading something on last night about the antigen testing, and there's growing concern that it's not as accurate.
So antigen testing is a loaded topic. We could probably spend 45 minutes talking about. I can tell you it has helped us manage schools because of the quick turnaround. It's an example of a point of care, a POC test. It's not as accurate as molecular testing, a PCR, looking for fragments of RNA. So these are viral antigens. There mostly is an issue of enhanced false negativity. You don't trust a negative test as much. There's false negativity with even the PCR molecular tests, right? About 30%, and changes depending if you get into details of where the patient is in their natural infection, what day you'd sample them, how thorough you were in getting that sample. So antigen testing, you lose a few percentage points in most discussions regarding sensitivity, its ability to detect disease. There are some specificity issues, that is, the positive you get could be a false positive. That is not the prevailing issue with those tests, and it's felt that if you are applying that test in a population that's got a significant presence of the disease, you trust a positive. If 2 years from now we hardly see a case of COVID in the county and someone has an antigen test positive, you'd say, I don't believe that. Let's run a PCR to back up the positive. But now, because we have so many cases, our positivity rate is high, the incidence is high in our region, we tend to more than not trust a positive antigen test. A test is only as good as the population you hand it. That gets a little technical, but that's true of any test in medicine. So the antigen test would not be a great test to apply in a low prevalence setting. But we have a lot of it right now, and it's a great tool because in 10 minutes you get a test result, and it helps us manage Johnny or Susie with a fever and cough who needs to get back to their classroom, maybe. Okay.
And Dr. Carlson, at some point regarding testing, if there's a vaccine that becomes available, would the health clinic move to administer the vaccinations, or is that something down the road to think about? Or
Yeah, I said in our presentation by the Indiana Hospital Association, and they're talking about a vaccine being available soon. Don't know which manufacturer, don't know anything about it, but they were saying that they would do a hub and spoke, and so a hospital would be the primary one to get it, and then they would have outlets to administer it. So like the hospital here would have MedStat and things like that. And Bowen Center would certainly consider applying to be one of those sites. But again, the details are vague at best. So I wouldn't rule it out, but I don't know if it would only be done through the hospital and their clinics. State Department of Health didn't elaborate on that.
All right, thank you. Yes, sir, Mr. Spalding.
Dr. Remington, I would guess you're still okay with trick-or-treat plans, but not so much with Halloween parties?
Correct. I think they've carefully worked out the details of how to do trick-or-treat here in the community. And again, it's an outdoor venue, large, it should be, and I think the risk is much lower. So again, trying to find your way with societal things that are good, that connect people with each other and have some semblance of normalcy. You got to find those somehow in the midst of all this. So yes.
All right. Anything else to add? Kurt, any final thoughts on clinic? Will you make an announcement, or is this the announcement that the clinic will be open tomorrow?
Yeah, like I say, it will depend entirely on being able to make sure my staff get trained today. And I think we have everything set up, but things can go wrong. And so the intent is to have that going tomorrow, but I will make sure I reach out to you and the Department of Health to let them know we're ready to go. And again, the signage will not probably be up yet, but the test site is right there. There's a big construction trailer, and, but soon we'll have the signage there also.
All right, thank you again for all your efforts. Teresa, any final thoughts?
Take precautions where you can so we can save the cases. Keep living your life. Respect others. Be careful.
Well said, thank you. All right, so we'll be back October 28th, again, which is in 2 weeks. I think the message has been the same from day one: mask up, socially distant, wash your hands, and of course the latest is avoid those indoor gatherings. All right, thank you all.
Thank you.